Your sexual health. Be aware and be safe. As a registered nurse, I understand the complexity of sexual health issues. The importance of sexual health awareness. Sexual health encompasses more than just preventing sexually transmitted infections and diseases. It involves a holistic approach to physical, emotional, psychological, and social well-being related to one's sexuality. Sexual health issues are increasingly prevalent in modern society. Cultural changes, social media, and technology have created a permissive environment in which young people feel more independent, expressive, and liberated in their sexual expression. In this high-tech culture where conventions do not necessarily become the rule, it is crucial to consider how we can protect ourselves and our loved ones from sexual health issues. Factors such as attitudes, behavior, genes, environment, and economy all play a role in sexual health. Our attitudes towards sex and sexual relationships shape our sexual behaviors. Our genes can influence our susceptibility to certain infections and diseases. Environmental factors such as pollution and poor living conditions can also have a negative impact on sexual health. Additionally, economic factors such as poverty and limited access to healthcare can exacerbate sexual health issues. It is essential to understand that sexual health problems can include STDs, HIV, pregnancy, infertility, cancer, and sexual dysfunctions. Addressing these issues requires a comprehensive and personalized approach. Sexual health is not just about physical well-being but also emotional, psychological, and social well-being. Sexual dysfunction, for example, can significantly impact an individual's sexual health and quality of life. Seeking appropriate medical care and support from healthcare professionals and mental health experts can help individuals manage these issues and achieve optimal sexual health. It is crucial to practice a positive and respectful approach to sexuality and sexual relationships, while respecting and protecting the sexual rights of every individual. It can be challenging to identify whether someone has an STD or other illnesses just by their appearance or behavior. Some STDs may not show any obvious symptoms. It is essential to be aware of the subtle signs that may indicate an infection, such as skin infections, sores, unusual discharge, or pain while urinating. Knowing your body and recognizing changes is essential in detecting and treating STDs early on, which can avoid serious infections that could lead to long-term or permanent damage. There are at least 25 different STDs that can be spread through sexual contact, including vaginal, anal, and oral sex. Common STDs include chlamydia, gonorrhea, bacterial vaginosis, genital herpes, genital warts, hepatitis, syphilis, and trichomoniasis. Some STDs can take a long time to display symptoms. Untreated STDs may cause infertility and can be passed on from a pregnant mother to her unborn child. Furthermore, an untreated STD can increase the transmission of HIV to sexual partners. Prevention is always better than cure. Abstinence is the surest way to avoid STDs. However, practicing safe sex can reduce the risk of sexually transmitted infection. Sexual health awareness can significantly reduce the risk of contracting an STD. Always use condoms during sexual intercourse, or dental dams for oral sex. Sanitize sex toys before and after use. Observe genital hygiene routines and always keep your hands clean. It is also essential to consult with a healthcare professional for sexual health advice and to get tested for STDs regularly. Professional sex workers are tested weekly because their livelihood depends on it. In addition to preventing and treating STDs, sexual health awareness also involves addressing pregnancy and infertility. Unplanned pregnancy can occur when couples engage in sexual activity without using contraception or when contraception fails. Access to contraception and family planning services is essential in preventing unplanned pregnancy. Infertility can be caused by a variety of factors, including infections, genetic disorders, and lifestyle choices. Seeking appropriate medical care and support from healthcare professionals can help couples manage infertility issues and increase their chances of achieving pregnancy. Mental health is also an important aspect of sexual health awareness. Sexual trauma, abuse, or violence can have a profound impact on an individual's mental health. It can lead to long-term psychological problems. It is essential to seek professional help and support if you have experienced sexual trauma or violence. Mental health experts can provide counseling and therapy to help individuals cope with their experiences and improve their mental well-being. Moreover, sexual health awareness involves respecting and protecting the sexual rights of every individual. Sexual rights include the right to consent, the right to access sexual health information services, the right to choose one's sexual partners, and the right to sexual expression free from discrimination, coercion, and violence. Individuals should be empowered to make informed decisions about their sexual health and well-being, and healthcare professionals should provide non-judgmental and confidential sexual health services. Sexual health awareness is particularly important for vulnerable populations, including adolescents, LGBTQ+ individuals, and those living with HIV. Adolescents are particularly vulnerable to unplanned pregnancy and sexually transmitted infections, and should be provided with age-appropriate sexual health education and access to sexual health services. LGBTQ+ individuals may face discrimination and stigma, which can impact their sexual health and well-being. Healthcare professionals should provide LGBTQ+ inclusive sexual health services. Create a safe and welcoming environment for LGBTQ+ individuals to access care. Individuals living with HIV require specialized care and support to manage their condition and prevent the transmission of the virus to sexual partners. Sexual health awareness is crucial for maintaining a healthy and fulfilling sex life. Sexual health issues are complex and require a comprehensive and personalized approach that encompasses physical, emotional, psychological, and social well-being related to one's sexuality. By prioritizing sexual health awareness, individuals can empower themselves to make informed decisions about their sexual health and well-being, seek appropriate medical care and support, and respect and protect the sexual rights of every individual. As healthcare professionals, we have a responsibility to promote sexual health awareness and to provide non-judgmental and confidential sexual health services to individuals in need. We hope this helps you. Ellen and Michael Moriarty, 2 RNs.